Well, welcome everyone. Um, my name is Paula Morrison. I work for Interior Health. I'm a practice lead in long-term care in the research department, focused on quality improvement and research. I have a passion for elders and intergenerational um, relationships, and I'm happy to welcome Arushan to Okanagan Embrace Aging. Thank you for coming. We're having a presentation on vaccines for older adults, what you need to know to stay healthy and independent. Um, and I'd like to respectfully acknowledge that Interior Health is situated on the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation. I'm grateful to be in the Kelowna area, but I know that I'd also like to acknowledge that you may be joining us today from near and far and many other places, and maybe you'd like to acknowledge the traditional owners and caretakers of those lands that you're on. Um, Welcome to the 13th annual Okanagan Embrace Aging Month, and thank you for joining us today. This month is co-hosted by Interior Health and the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan. And this month was launched 13 years ago to celebrate and raise awareness about positive aging, and has once again been organized with a number of educational opportunities and events through the month of March. The sessions are designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve quality of life among seniors and family caregivers. Our goal is to inspire everyone to embrace aging and embrace it positively. Just some housekeeping pieces, closed captioning. If you need to turn off closed captioning off, select the hide caption button on the menu bar. Questions, you can type questions or comments for the speaker into the chat box during the presentation. And at the end, we'll have a Q&A component. And please be prepared to give us feedback for this event. Please complete the survey that will be emailed to you at the end, and there'll be some information coming your way at the end of the presentation. Arushan has kindly agreed that we could share his slides, so don't worry about taking those notes unless you want to, and there'll be some links added as well. Yeah, so today's session is vaccines for older adults, and like I said, what you need to know to stay healthy. And I'm going to pass the screen sharing over to Arushan. So thank you, Arushan, for being here. Appreciate it.
Thank you, Paula, for having me, and I'm really excited to speak with everyone today as part of Embrace Aging Month about vaccines. My name is Arulnamby. I'm a policy analyst at the National Institute on Aging. We are a policy and research center in Canada focused on looking at aging from various perspectives: financial, physical, psychological, and social wellness. For the past several years, I've led the development of the organization's work on vaccine-preventable diseases among older Canadians. And I look forward to using my research and experience to provide everyone today with the needed information to be well informed on vaccines for older adults. Just to give a quick summary of the key topics, we'll be talking about the impact of vaccine-preventable diseases, why exactly are older adults at greater risk, the national vaccine recommendations, and the coverage provided specifically in British Columbia, current vaccination rates, and lastly, I would like to share various vaccine guides and pamphlets that some of you might find useful to understand more about vaccines, surrounding recommendations and coverage. What are vaccine-preventable infectious diseases of concern for older adults? There are six in particular. These are COVID-19, influenza, also known as the flu, pneumococcal disease, pneumonia, respiratory syncytial virus, it's commonly known as RSV, shingles, tetanus, and diphtheria. For all six of these infectious diseases, there are effective vaccines, national recommendations, and some are even covered for free based on where you live, which we'll go more further on into today. So let's discuss about really why it's important to focus on these infectious in these vaccine-preventable diseases. One of the main biggest reasons is when we look at the top causes of death in Canada, three respiratory diseases are noted in the top 10: COVID-19, influenza, and pneumonia. This is not just a one-year occurrence in 2023. It was actually, this has been seen a common trend over several years. And when we look into that list a bit further, we find out that actually over 13,000 older Canadians lost their lives to COVID-19, influenza, and pneumonia. It's important to note that these are largely vaccine preventable causes of death. And now when we go further into these infectious diseases, we'll start talking about COVID-19. Just to give a quick summary, COVID-19 is an infectious disease that's caused by SARS-CoV-2 virus. Symptoms can vary in how severe and frequent it appears. However, for older adults, symptoms may appear differently. Sometimes the fever could be mild, or the older adults may have less common symptoms, such as nausea and congestion. COVID-19 is very impactful for older adults, which is clearly seen by how the risk of hospitalization for severe illness and death from COVID-19 is significantly higher for this population, with 76% of Canada's COVID-19 hospitalizations occurring among older adults and 95% of Canada's COVID-19 deaths occurring among this population as well. This clearly shows that when older Canadians get infected, it can lead to severe outcomes. And something we have seen over the past few years is that COVID-19 infections may lead to a condition called post-COVID-19, also known as long COVID. This is where symptoms may present for 3 or more months after the onset of the infection and last for several weeks, which cannot really be explained by any other condition. Various symptoms can be experienced, with the most common ones being fatigue, pain, and decreased quality of life. This just goes to show that when you get COVID-19, it's just not that very short-term occurrence of symptoms, but it can lead to long-term issues as well. And now let's talk about two other respiratory diseases, influenza and pneumonia. Influenza is very common, is something that we have constantly been aware of. And just to talk a bit more about pneumonia, it is a lung infection that impacts our respiratory system. Symptoms include difficulty breathing, coughing up mucus and fever, and people may also experience fatigue, nausea, and vomiting. Older Canadians are at higher risk of severe outcomes, even with flu and pneumonia, which is evident by how over 40,000 inpatient hospitalizations were among adults 65 years and older in Canada, where pneumonia was the most responsible diagnosis for those hospitalizations. And within this age group, pneumonia ranked fifth among diagnoses with the most amount of hospitalizations. There were also over 5,600 deaths among adults 65 years and older in Canada that were caused by influenza and pneumonia. And older adults alone made up close to 90% of total deaths caused by influenza and pneumonia. Just like COVID-19, when older adults get influenza and pneumonia, it can lead to severe outcomes. And there's also another respiratory infection I want to just talk about today as well. It's called RSV, short for respiratory syncytial virus. It affects the airways and lungs, causing infection in the respiratory system. It starts with the upper respiratory tract symptoms such as nasal congestion, and then leads to the lower respiratory tract symptoms such as difficulty breathing. But but here's the thing. There are actually many overlapping symptoms between RSV and other respiratory viral infections, making it actually very difficult to differentiate between these infections. And similar to influenza, RSV is very common among the fall and early spring time. It's highlighting why we should be protected from both these infectious diseases. And I would like to highlight, similar to the other diseases, RSV infects people of all ages. But with the burden of RSV, greatest for those very young and older adults. But there is a catch, and I wanted to show this through this diagram here. In this slide, the blue color represents children younger than 5 years of age, and the purple section represents adults 65 years and older. If you look at the left of the slide, we notice that young children make up the majority of hospitalizations from RSV, whereas older adults make up just under a quarter. But here's the thing. Amongst the hospitalized young children, 1 in 1,000 pass away, whereas among older adults, 1 in 9 pass away. And what happens is now that when we look at RSV deaths, older adults actually make up 85%. This continues a common trend that we have seen throughout this presentation so far, that older adults face severe outcomes when they get infected with vaccine-preventable diseases. And just to give a bit more education on RSV, compared to influenza, it's actually very similar burdens that are experienced among those who get hospitalized by either influenza and RSV. And we see this across the board when it comes to lower respiratory complications, bacterial infection, cardiac complications, readmission to the hospital, and even deaths. When we compare those who are hospitalized for influenza and RSV, it's actually very similar, highlighting why it's important that we get vaccinated for both these vaccine-preventable diseases. And I really like this diagram here because it highlights a point that I noted earlier, how when we get infected by certain diseases, not just that few weeks of feeling a bit sick, it actually could lead to long-term impacts. And this diagram shows that it even goes beyond hospitalization. So when it comes to a study actually evaluated long-term changes in function among older adults with RSV associated hospitalization. What was found was that 6 months after discharge, a third of patients experienced decreased levels of function, and 8% fewer patients were able to live independently. What does this mean? Is that those individuals are more dependent on caregivers or might need long-term care services. This just shows how when old adults get infected with diseases, it can lead to long-term implications. And another disease I would like to discuss now is about shingles. Last week was Shingles Awareness Week, which you might have seen a lot of promotion on this disease and its associated vaccine. So, what is shingles? Shingles is an infection caused when the chickenpox virus we might have gotten as a kid, it gets reactivated in the body. But it presents a bit differently. Chickenpox comes all over our body, whereas shingles, it's more localized. It's more in a specific part, and it's a very painful, blistering rash. Canadian studies have found that older adults have a higher rate of shingles infections, which is most evident by how over two-thirds of cases are among adults aged older than 50 years. Also, older adults experience higher rates of complications. And this is the most evident when we look at rates of post-herpetic neuralgia, PHN, which is a painful condition that can last for more than 90 days. And we see that older experience this more than the rest of the population. We also see older adults have the highest rates of shingles-associated hospitalizations, and deaths rates are also high among older adults, clearly showing that this is an at-risk population and the importance of being protected against shingles. And now I want to actually show you that what we discussed the last few minutes was just very direct effects of this of vaccine preventable disease. But it actually the burden of these diseases goes beyond that. There's actually a lot of indirect complications that can happen when you get infected by any one of these three diseases. For example, herpes zoster, also known as shingles, influenza, and RSV, could also increase the risk of stroke. All three can also increase the risk of myocardial infarction. And influenza RSV can increase the risk of pneumonia, whereas RSV can also increase the risk of congestive heart failure. These are conditions that we won't normally connect back to vaccine-preventable diseases, but studies have showed that when people get infected by these diseases, it actually increases the risk to these long-term conditions. And lastly, I would like to discuss about tetanus, also known as lockjaw, and diphtheria. These are two conditions we don't normally talk a lot about, but there is a vaccine, and important we highlight them here as well. Both these infections continue to impact us at all ages and can lead to serious outcomes. Tetanus, it causes painful muscle spasms and difficulty swallowing, which could lead to fractures, whereas diphtheria can cause numerous symptoms, including mild fever, trouble swallowing, and lead to effects on the central nervous system. Unvaccinated older adults have one of the highest death rates from these conditions. And I hope through the last few minutes you see why it's important we give more awareness to these diseases, why we should know the impacts, and why this will hopefully lead to more vaccinations, because it's important, the importance of being protected across all six of these conditions. So, so I've noted all adults are at risk. They will face a lot of conditions, a lot of from these diseases. But why are older adults at greater risk? Why do they face most of the complications? There are three reasons for this. One is that as we grow older, the strength of our immune system reduces due to aging. This makes us more prone to severe diseases. This also reduces the impact of vaccination, showing the importance of staying up to date with vaccines. Also, old adults have a reduced strength of the respiratory muscles and diaphragm, which impacts lung expansion and a person's ability to fight off infections. And thirdly, also old adults experience an increased number of chronic conditions, increasing risk of complications. And to show that first point visually, where we have, as we grow older, the impact of the reduced immune system, I would like to direct you to this graph on the slide. The gray line represents the strength of our immune system throughout the lifespan, whereas the purple line represents the risk of infectious diseases across the life course. When the immune system response is low, the risk of infectious diseases is high, which occurs first when we're young, when our immune system is still immature, and later in life as we get old and the immune system deteriorates. This highlights why being protected against vaccine-preventable diseases is important, not just for our young children, but also for older adults, and also why these groups experience more severe complications compared to that middle group of adults. And I now want to also talk about how vaccine-preventable diseases are associated to medical chronic conditions, but this is actually in two ways. Firstly, medical conditions can make you more prone to infections. And and the other way is that infections can make you more prone to medical conditions. So it's this two-way impact. And to show you that, I want to highlight how people with chronic conditions such as heart, kidney, or lung disease have a higher risk of contracting pneumonia, whereas those with pneumonia has been associated with a higher risk of health failure. So it just shows how where chronic conditions can lead to more prone to infections, but also infections can also impact the other way as well. But more than me just telling you right now, let me show that to you visually. And the best way to show this is through a cycle. Not only can comorbidities increase susceptibility to infection and severe outcomes, but these severe outcomes can in turn lead to of accelerated functional decline and worsen comorbidities as well. So it's like a big cycle, and this decline is further increased by increasing age. And this cycle visualization, I'm going to actually take it to another concept when it comes to vaccines as well. It's regarding reinfection of vaccine-preventable diseases. This So basically, as when after we get infected, the immunity sort of decreases over time against that virus, and we can get infected throughout life. So it's like a cycle. So it's important that we get vaccines so it can stop that cycle where maybe that protection we got from a virus or disease, when it reduces, we have something to protect us moving forward. And before I go further, I actually wanted to show you when viruses are very common throughout a calendar year. We constantly hear the term flu season, and or you might see a lot of promotions of vaccines during the winter months. This is because respiratory viruses like flu and RSV are actually higher during the fall and early spring period. As you could most evidently see here, that purple line is representing the flu, whereas the lighter blue color is representing RSV. And the black line is COVID, which is very consistent throughout the year. So we talked about the impact of vaccine-preventable diseases. We talked about why all adults are vulnerable to these diseases. Now let's talk about why are vaccines important. Let's go further into this topic. There are few reasons. One, as we noted, immunity weakens as we age. Secondly, vaccination helps prepare our bodies to fight off infections. Yes, we have an immune system that can sort of adapt and learn to fight off viruses, but here's the thing, it takes time for our body to understand how to fight off different viruses. Vaccines or gives us a blueprint to understand, help our body understand how to combat viruses when we get them later on. So what's the importance of this is that by having our body ready to fight off viruses, it reduces chances of severe problems down the line. And thirdly, vaccination helps us protect others. When we all get vaccinated, it reduces the chance of the virus or bacteria to spread and infect others, especially those who are not able to get vaccines. And fourth, vaccines have eliminated certain deadly diseases. This is most prevalent in Canada. For example, Canadians no longer need to be vaccinated against smallpox just because these vaccination has been so effective. So, also, our acquired protection can weaken over time. Over time, the protection by vaccines provided may decrease for certain infectious diseases, and that highlights why we need to get booster doses to help strengthen our immunity. And the last point is that vaccines are a very safe option. I've done research in this field for several years, and it's constantly shown how vaccines go through not only a lot of testing before it gets approved, but even after getting approved, it goes through rigorous monitoring to ensure that what is available for you by your doctor or pharmacist is the most safest option available possible. And why we're doing our presentation today, why it's important to be fully informed about vaccines every year, is because there's always new vaccines or new recommendations of certain groups that need to get a certain vaccine. So it's important to be educated about this every year. So now let's go into recommendations and coverage. First, I'd like to start with COVID-19. Canada's National Advisory Committee on Immunization, also known as NACI, they are the ones who provide the national recommendations. They note that they recommend all the Canadians, regardless of their vaccination history, should receive at least one dose of COVID-19 vaccine per year. There's no preference between what is either of the two currently available vaccines, known as LP8 COVID-19 vaccines. There go no one here has Spikevax and Comirnaty, but they're also known as Moderna and Pfizer. Uh, and based on your older adult's immune system, their previous vaccination history, they may be needing to get more than one dose per year. For example, certain groups who have already received all their vaccination are recommended to receive two doses, and these group individuals include adults 80 years and older, those who live in long-term care homes, and those with weakened immune systems. So speak to your healthcare provider and see how many doses you need per year. The next one is influenza. NACI recommends Canadians get the influenza vaccine every year. Why is it that they need it every year? It's because the strains constantly change within the vaccine to better adapt to what is being currently transmitted across society to make sure the vaccine is most effective against the current viruses that are most predominant. They specifically, NACI recommends older adults receive a specific type of influenza vaccine called enhanced influenza vaccines. They go by, there's two currently available, Fluade and Fluzone High Dose. Why is these specific vaccines recommended? Because they provide an added effectiveness while being equally as safe, which is most needed for certain at-risk populations like older adults. In British Columbia, Fluid specifically is available for free. Whereas for COVID-19, both two options that are currently available across Canada are available for free in British Columbia. Next, I would like to just talk a bit more in depth about RSV vaccines. This is something very new. It just became available in the last few years. There are currently three RSV vaccines for older adults, Abrysvo, Avexri, and MRSVIA. So NACI recommends one dose of the RSV vaccine for adults 75 years and older, especially those with certain health conditions, and adults 60 years and older who are residents of long-term care homes and other chronic care settings. The RSV vaccine may also be considered for adults even younger who are 50 to 74 years in consultation with their healthcare provider. There's currently no preference between either of the three vaccines for adults 60 years and older. But if you're in the 50 to 59 years group, only Arexvy can be used. It is not currently publicly covered in British Columbia, but if you have a private drug plan, it may cover the cost, and I highly recommend contacting your insurance company. And I want to go more further into that last recommendation there, that 50 to 74 years kind of notes that it is maybe considered for that group, this RSV vaccine in consultation with your healthcare provider. I would like to provide a list of conditions that has been noted by the US of certain conditions that they would recommend getting the RSV vaccine. And I would like to show to you all today that if you have any of these conditions, especially in that if you're in the 50 to 74 years age group, to go and speak with your healthcare provider to see is this vaccine should you get it as well. The conditions encompass various groups, including chronic conditions, those who are immunocompromised, and also residents in long-term care homes. And as you can see, it's quite a comprehensive list. And as this will be shared with you after the presentation, I highly recommend you looking into this after as well. So we have talked about RSV vaccine. Now let's talk about pneumococcal vaccine. The current recommendation is that all adults 65 years and older get one dose of either Prevnar 20 or Capvaxive vaccine, regardless of whether you have received any other vaccine in the past. And also I just want to highlight, even if those two are not available, there are other vaccines, pneumococcal vaccines available that may be used. Currently, in British Columbia, Prevnar 20 is free for all the adults based on your previous vaccination history and risk factors. Uh, Now to talk about shingles, it's the national recommendation notes that the two-dose vaccine is recommended for Canadians aged 50 years and older. older. And in British Columbia, it's actually only covered right now through the First Nations Health Authority and federal government programs for First Nations and Inuit peoples, veterans and veterans. So, so it's only a specific group of people who are actually covered for this vaccine. But as I noted, please speak with if you have private health insurance, please speak with your insurance company to see if they provide any coverage. The next one, the last one we're going to talk about is tetanus and diphtheria. And this vaccine is currently recommended for those who have already received these vaccines from young age, a booster dose of every 10 years. This is just this. I just want to highlight this is only for those who have been fully immunized of tetanus and diphtheria vaccines from throughout since they were young. For those who might not have received all the vaccines, they might have more doses that might be recommended, and this is something you can speak with your healthcare provider. This coverage is currently provided free in British Columbia. So we said how important it is to get vaccines. We see the impact of vaccine-preventable diseases, but the reason why we're doing this presentation, the reason why there's a lot of education work being done on vaccines, is that we see vaccination rates are actually pretty underwhelming among older Canadians. For pneumococcal vaccine and annual influenza vaccine, you see that red line, that's the target in Canada-wide, 80%. But it's actually, we see, especially with pneumococcal vaccine, it's much below. And shingles vaccine is even further below than that. And when I looked at the data further, we noticed that when we look at each province and territory, this rate it could go as low as for shingle vaccine, it can go low as 25% of the population being covered, actually receiving this vaccine. So there's a lot of work that needs to be done. That's why we are here today, and we are hoping that through this presentation, more people get to speak with their healthcare provider and see if they can get vaccinated. And I know COVID-19 vaccine, there's a lot of promotion to get that vaccine early in the pandemic. Everyone got it. But what we do realize is that yes, a lot of people have received at least one dose of the vaccine. But when we look at who has received the most recent vaccines, the ones that are currently available to best protect against the current strains, it's only 10% of all the Canadians were up to date with their recommended COVID-19 vaccines. So, so it's important that yes, there's some vaccines such as shingles, pneumococcal that have lower uptake, but there's also low uptake for COVID-19 vaccines as well currently in 2026. And so a strategy I want to note that what's a great way of getting all these vaccines is getting them together. Vaccines may be safely given at the same time together. So it's important to ask your healthcare provider what vaccines you're eligible for and which could be safely co-administered to make it more convenient for you to stay up to date with your recommended vaccines. And as we are just nearing the end of the presentation, I want to highlight immunization is a team approach. It's yes, we as the patients important to be informed, important to ask our healthcare provider, and it's also all these other stakeholders have to play a part, and which is what we are actually pushing through our organization, trying to bring more awareness to all these different groups, trying to see how we can try to make it easier for the patient to get all the immunizations they need. I know I've shared quite a bit of information over the past 30 minutes, but not to worry, these slides will be sent to you. But I also want to highlight some great resources that we, the National Institute on Aging, has recently shared. We created something new this last year was the provincial territorial vaccine one pages. So these one pages were that in one page we summarized the for all six recommended vaccines, what are the national recommendations and what is the coverage provided specifically in British Columbia, and where all the adults and caregivers can go to get more questions asked. This is available on our website. It's actually the links are shared on the chat in this webinar. I'm happy to note that this resource is available in English, French, simplified Chinese, traditional Chinese, and Punjabi. And I would like to highlight, it's not just British Columbia we have available. We have a one page available for every province and territory in various languages. So I highly recommend you check out this resource to see what you can get, vaccines you're recommended, and what is actually covered in your province or territory. For those who might be more interested in understanding more about each of these vaccines, we created a pamphlet called the Guide to Vaccines for Older Canadians that goes more into depth about the impact of each vaccine-preventable diseases, recommendations, coverage, and further links and resources. And lastly, we also have a COVID-19 vaccines pamphlet, which is a Q&A type of pamphlet, which answers some of the most commonly asked questions on COVID-19 vaccines in a very concise way. And it's a very informative pamphlet that we just updated as well. And I would just want to thank everyone for your time today. I hope this presentation was very informative, and I look forward to answering all your questions.
Thank you so much. Thank you so much. I was frozen there for a moment, I noticed. Arushan, I appreciate this. I definitely have been learning as you've been presenting. So I do have a few questions that have been presented. Um, and the first one that was sent in was, how long after having shingles would I wait before having the vaccine? I had the original vaccine in 2005.
Yes, thank you, Paul. That's a great question. So the shingles vaccine, also known as Shingrix, is is recommended for adults 50 years and older, regardless of whether you have received a previous shingles vaccine, or even if you had shingles as well. It's recommended for all, and for those who have previously received a older vaccine, you may be considered after a year.
And after having had shingles too?
After having shingles, yes, it's around a year as well. But
Oh,
it's the good thing is that for both these groups, it is recommended. So if you fall into either of these categories, please speak with your healthcare provider.
that's thank you. That's great to know. Um, And a question was posed, not, are Pfizer and the other common vaccine different than the ones you showed on your slides?
Did they say which for which vaccine preventable disease?
I think that it was for COVID, if they're asking about Pfizer, I think.
Yes. So right now, there are two COVID vaccines available, Pfizer and Moderna. The names you saw on the slide were just the product name of for Pfizer and Moderna, what they actually call it. So both are equally effective and equally safe. There's no preference for either of the vaccines at this time. We have received a lot of research over the last few years of these vaccines, and the recent recommendations note that either of them are fine for older adults.
Oh, that's good to know. For the other question we have here is for the Shingrix vaccine after receiving the 2 doses, is there some period of time after which a booster dose should be administered?
I'm glad this question was asked because I recently did a bit of research on the shingles vaccine. There's no booster dose recommendation right now. Why is that? Because the shingles vaccine is so effective. It's in just a few years after you have received it, you have over 90% effectiveness rate. And the best part is that we have seen that even after 11 years of getting the vaccine effectiveness is still really high. So, which is clear why there's no booster recommendation at this time, because once you receive it, you are well protected, especially if you received the Shingrix vaccine, just to be clear. So, if you have received it, there's no booster dose recommendation because it's really effective.
That's great. Um, what is happening to try to cover these vaccines for seniors who are on limited income? Do you know?
From my research, it appears it's really based on the province and territory of what types of programs and supports are being provided. currently in British Columbia, there are none that I have been aware of where they are supporting those with limited income. However, this is always changing. There are always new programs becoming available. So there's something you can speak with a pharmacist or physician to see, is there anything new that can new initiatives that can help you access these vaccines?
Thank you. Another question is around shingles. I received the old shingles vaccine at the age of 60, but now 10 years later, I'm planning to get the newer Shingrix 2 dose singles vaccine. Is now a good time to get it, and how far apart should be those two shots be given?
Yes. So yes, from the question, it appears there's 10 years. So I think that from the recommendations, that is enough amount of time to go to speak to your physician or pharmacist to get the vaccine. It's actually the two doses is it's you need to spread it apart by a certain amount of months or weeks. It's really based on your health conditions that will judge the amount of time you need to give between the two doses.
Wow. This is not an older adult question, but more related to younger people. But the question is, I was told by a healthcare provider that there have been issues with Moderna with younger people who have developed heart issues. They're suggesting Pfizer for younger people and not Moderna. Is this true to your knowledge?
If you don't mind, Paul, could you mind repeating that if that's okay?
Yeah, I was told by a healthcare provider that there have been issues with Moderna or healthcare prof, might be a professor, that there have been issues with Moderna with younger people who have developed heart issues. Thus, they are suggesting Pfizer for younger people and not Moderna. Is this true to your knowledge?
Yes, I have I have read some research on this. What you have noted there, Paula. I would like to note that this was, I believe, this really was brought to my attention early on in the pandemic. Most of my research is focused on older adults, so I would highly recommend just speaking a bit with your pharmacist or healthcare provider to see what they would recommend because there's always new research becoming available and it's I just want to highlight the vaccine that was being provided a few years ago. It kept on changing every year. There's a new version of vaccine and new research being available. So, yes, I'm aware of what you had noted, but that was really early on in the pandemic, and it's best to speak to your healthcare provider if that still stays true today and which one you should receive.
That's good information too. Yeah, that dynamic piece of it, right? Dynamic. Is a booster recommended for the pneumonia vaccine?
At this time, booster dose is not recommended. Uh, However, even if you have received a previous version of the pneumococcal vaccine, it is recommended you receive that new version that is becoming available. Apart from that, there's no more booster doses that are currently recommended at this time.
Now you're going to make me go look up what I got and make me think. Um, if the shingles vaccine is effective, why would we be revaccinated after 1 year?
So, uh, just to clarify about that, when I said the Shingrix has just become available in the last few years.
Okay.
The older version is called Zostavax. That's the one that everyone you have asked the last few questions must have received a few years ago because Shingrix is a very new vaccine. Zostavax is not as effective as Shingrix. I've seen the long-term studies, and actually effectiveness drops really quickly after a few years. It's where Shingrix is much more effective, and that is why it's recommended that after a year, around a year's time, even if you have received the oldest Zostavax vaccine, to receive the new one because it provides so much protection.
Oh, interesting. And I think I did the Shingrix, so I that advertising for it is um, very good, and it catches your attention. So, this question, where do you receive tetanus vaccines? From the pharmacist or from who do you get them from?
Yes, so they are. It's actually a wide array of provide could provide tetanus and diphtheria vaccine. So just to clarify, tetanus and diphtheria, even though two conditions, they come together in one vaccine. And it's really based on which province or territory you live in, but most often pharmacists, for your family physician or public health unit will be able to provide that vaccine.
Oh, interesting. I'm not sure where this individual's coming, like located, but this is another question related. And they said they had a tetanus diphtheria and they got it for free at the time. They were told that diphtheria, oops, that jumped on me, addition was not covered, um, other than for pregnant women. And I don't know if you know if that's correct. And maybe it's a province, like you said, province specific answer to that.
Yes, the tetanus and diphtheria, there's actually various tetanus and diphtheria vaccines, and there's variations in what each province and territory covers. Uh, and that's why it's very location specific when it comes to answering these questions.
Fair enough. Um, and someone shared they had their tetanus at the pharmacy in 2020, and it was a scheduled appointment, just for information, and that's someone located in the Okanagan in BC. Someone asked had they had received the pneumonia at age 65. I'm assuming vaccine. Should a newer version be given now at age 75? I think
Um,
it is the vaccine and not the illness.
Uh, yes. The two new vaccines, Prevnar 20 cap vaccine, these have only been available in the last few years. They are recommended regardless of whether you have been up to date with the pneumococcal vaccines or not. So please speak with your healthcare provider to see when you can receive these vaccines.
Okay. Um, Hi, my dad is aging in place with me in my home, COVID vaccine at 83 was the only one he got an invite to have a COVID vaccine was this year. I didn't receive an invite. Do I need to get this? And how do I get the invite? I think that would be a conversation with your healthcare provider, but your response to should they get one as a
Yes,
caregiver?
and just to clarify, Paula, are they asking for their family member or themselves?
I think themselves.
Yes.
Yeah.
Um, Uh, yes, COVID-19 vaccines is recommended every year. And just as I noticed, just based on the health conditions, your vaccination history and age, you might need more than one dose.
That's good. I was just gonna, there is a vaccination website I was just gonna see if I could find it quickly, but I'll do that in a moment. Another question was, I had my tetanus at the pharmacy in 2020. Oh, sorry, that wasn't a question. That was a statement that I had shared earlier. I think we've covered all the questions that have been presented. Yeah, I appreciate that. Maybe we can include that one with when we send it out, that link. And yeah, I really appreciate your time and I appreciate everybody coming. There are some other links that Arushan has shared with us. They're in the chat there if you'd like to get them, but we'll send them out as well in addition to the one around the local BC COVID vaccination information. So yeah, I appreciate it. Um, Thank you for being here, and for it was great to meet you and great to hear all the information and the learning from you. Appreciate it. I'm encouraging everyone to attend other events that are scheduled through Embrace Aging Month. Please visit our website, OkanaganEmbraceAging.com, for all the events and registration. We look forward to growing this event in the Okanagan and encourage anyone interested in supporting Embrace Aging in the future, please contact us. Contact information is available on our website. And you'll receive an email with a link to an online evaluation form, and we'll welcome everyone's feedback and suggestions for planning Embrace Aging events in the future. And yeah, I appreciate it. Thank you for taking the time with us today.
Thank you, Paula. I just want to say thank you, everyone, for attending this webinar as well. Vaccine information can get very confusing. Everyone's trying to share different types of information, but thank you for coming here, trying to get educated on it. I hope you can access the links shared and learn more. And I'm happy to answer any questions as well in the future.
Thank you so much.